Good evening, everybody. So I welcome you all to Boldsky's Health Talks. This is Deepanita Das, Associate Editor, Boldsky. And today we will be discussing on fertility preservation and the role of psychological support in managing emotional aspects and anything related to this. So we have with us Dr. Chandana Lakkireddi, Senior Fertility Specialist from ESHA IVF Fertility Clinic, Dr. Yashwani Shenoy, Chief Embryologist at ESHA IVF Fertility Clinic, and Dr. Puspha Ragaveni B, a clinical psychologist. So, welcome, doctors, and hope you all are good. So, if, yes, ma'am. So, shall we begin?
Yes, we can.
Thank you. Yeah, so first, I will be directing my questions to Dr. Chandana Reddy. So, ma'am, like it will be related to fertility preservation. So, can you tell us what is fertility preservation and who requires it?
Sure. So, fertility preservation is basically like preserving the gametes of the female or male for their future use. So, this could be either egg or embryo, or it could be sperm as well. So, this looks quite simple, but I mean, when we explain things, there are a lot of things related to this. So, basically, like first we can start with who requires fertility preservation. Do we need to suggest to every infertile patient, or is it really related to infertility? Not actually. I mean, fertility preservation is a bit different from the infertility. So this can be divided like into medical reasons, and it could also be related to the onco fertility, which I'm going to talk in detail as we move on. So medical reasons or social fertility preservation. This, if we see a female who is unmarried, but there is a chance of compromise of her fertility in her future. So she is going to lose out on her eggs in future for various problems, like whether it's an endometriosis or whether it is related to the cyst present in the ovary, or it is the social reason. Social reasons means she doesn't have any problem now as such, but in the future, because she is delaying her conception as such, there is a chance she might lose out on her eggs. So what we would suggest to them is, so as we all know, female age plays a very important role in the conception. So every female is born with millions of eggs, but as the age goes on, they lose out on eggs every month. So in the fertility preservation, we are basically preserving these eggs, or we are capturing these eggs before they have problem with the egg reserve. So social reasons, as I said, like a lot of women nowadays, they want to postpone their marriage, conception, basically because of the career, education, or they want to first settle down in their, life, then they want to plan the pregnancy. But by the time they plan out all this, there is a chance they might have, have reduced ovarian reserve. So what we would suggest is, so they can actually preserve their eggs when they are young. Young means anywhere under 30 years. So post 30 is what we look at a reduction in the ovarian reserve. So we freeze their eggs, and when they are ready in the future for the baby, probably they can use these eggs which are frozen at their younger age and get a good pregnancy and a healthy baby as well. So the other problems I was mentioning, if the female have an endometriosis or they have a big cyst sitting in the ovary and they're going for the treatment for that, there is a chance during the treatment or the surgery, they might again lose out on the eggs. So what we do is we collect the eggs from the ovary, we preserve them, followed by their medical treatments, so that they are not going to lose the healthy eggs, and post surgery or the post treatment, they can use these eggs which are preserved before and get in healthy pregnancy. So this is basically more like medical and the social reasons. And there is totally a different, type of clientele we see, which is called onco fertility. These are like cancer patients, whether it's in cancer in the males or cancer in the females. So what can happen is because of the cancer treatment as such, like if they are having a surgery in the pelvis, whether on the uterus or ovaries, or whether it is related to cancer, post-cancer treatments like chemo and radiotherapy, there is a chance sperm and the eggs can get reduced. So before going to the cancer treatments, we counsel them for the preservation of their gametes, whether it is an egg freezing or if they are married, we can do an embryo freezing. Embryo freezing is mixing up of the egg and the sperm of the male partner. And further means we can do sperm freezing. So that post-cancer therapy, even if their fertility is affected, they can always use these gametes which are preserved before their treatments in future for their kids. Because nowadays, with the improvised cancer treatments, the survival rate has really increased. So, I mean, these options need to be well counseled to the cancer patients even before we go forward for the treatments.
Okay, Max. Thank you. And can you also, like you said about freezing eggs and freezing embryos? So, can you briefly tell us about like how both are like different, or like how
What is
to proceed? Like whoever opts for it, how to?
Sure, sure.
Yeah.
So the main difference between both is egg freezing, it's more for the unmarried woman. Embryo freezing is for the married woman. So if an unmarried woman is undergoing a cancer treatment or undergoing a surgery, what we would suggest is to undergo a process called stimulation of the ovaries. So what we do is we give injections from their period, and then we, do the scans to check how the ovary is growing the eggs. After 9 to 10 days of these injections are also quite small. They're more like the insulin injections, not that painful. So we collect the eggs through mild sedation, so in which they will be put to sleep, but not like a deep anesthesia. We collect the eggs and then we can preserve the eggs on the same day. So the process we use to freeze this eggs is called fast freezing or the vitrification, which our embryologist is going to explain in detail. In embryo freezing, the only difference is after we collect the eggs, we inject the sperm of the female, uh, the male partner, and then we form the embryo. Then we grow the embryo in the lab for 3 to 5 days. Then we select the best embryos out of it and then freeze them. That again with the same freezing process called vitrification. So sperm freezing is totally different. That doesn't involve any injections or like that. They just give the sperm sample how they give for testing, and on the same day that will be freezed. But prior to that, they will require certain tests, like the infectious diseases screening like HIV, hepatitis. The same test will be done for the female. For the female, other than this test, we do also check the hormones to see like what is their ovarian reserve and what is the dose of injections we need to give and how many injections we can actually plan. So ovarian reserve testing could be done either through a blood test or it could be also done through an ultrasound, in which we count exactly how many eggs are there in the each ovary. And this is very important to counsel the patient as well, because sometimes we might need to do 1 to 2 cycles to get decent number of eggs to be frozen. Because if the ovarian reserve is less, we may not be getting good amount of eggs after 10 days of injections as well.
Okay. Okay. And another thing I want to ask you, like, is there any age limit for fertility preservation, and like, what is the scenario of fertility preservation in India? If you can tell us something about that.
Sure. So as I was mentioning about the ovarian reserve, so number of eggs is important. Like females, what we have seen is once they cross 30 years, the egg reserve seems to decrease on a faster pace. So if there is any female over 30 years, first we would like to assess the number of eggs on the ovarian reserve. So up to 40, 43, I think if the reserve is good, we can do the egg freezing. But post 43, 45, not only the number of eggs decreases a lot, there is also issue with the genetical errors in the eggs. So there is a chance even if we freeze eggs at that stage and do the treatment, there is a chance they might end up in a pregnancy with genetical problem or abnormal babies. So that we wouldn't suggest. And fertility preservation scenario in India, Yes, people are nowadays, opening up. We recently had a case. She's just 23-year-old who is who is going to get married in this year or the following year. She just approached us with an irregular periods. So when we investigated, what we have found is her egg reserve is almost going to go to zero. So then we counseled her about this fertility preservation, and she was open to that option. So we have given the injections and we have freezed decent amount of it. So what she will be planning post, marriage, she can always come back. After 2 years, 3 years, whenever they're ready for the baby, they can use this eggs and get the pregnancy. So people are coming to us. So when we, counsel them in a proper way, they are open to this option of, fertility preservation. Lot of companies actually they're funding their female employees for the fertility preservation if they were, postponing the conception for their career. The same thing we have seen with the onco fertility as well. So a lot of oncologists, medical oncologists, surgical oncologists, they are counseling their patients. Recently had a patient with ovarian cancer who was, she's an unmarried again, who's going for a surgery on the ovary, and she might lose out on the exposed surgery, and also they were planning chemotherapy. So she has been referred to us with proper counseling. She also wanted to go for fertility preservation. So we have done the process and we have preserved her eggs. Now she has gone for the cancer treatment. So in the future, if needed, she will always come back to us and we can use this eggs for a healthy baby.
Okay, ma'am. Thank you, ma'am, for sharing your experience and knowledge. I'm sure our audience will be like it. They will be very. It will be helpful for them, and so thank you so much for joining us. Now I will be I have few questions for Dr. Yashwani Shenoy. Ma'am, can you hear me?
Yes, yes. Can you hear
Hello.
me?
Yes, ma'am, I can hear you. Okay, so so ma'am, I would like to ask you, like, can you tell me about like what is the role of an embryologist at a fertility clinic? Can you tell us a bit about it?
Yes. So the word embryologist is like having a qualified person in the center to handle the gametes and the embryo of the patient with uttermost care. So the basic role of the embryologist in IVF center starts from collecting the patient's egg, which is collected in a process called ovum pickup, in which the gynecologist collects the egg from the patient, from a stimulated patient, and gives to us. Then what embryologist does is keep the egg inside the incubator in a proper condition. Incubator is a instrument which mimics the uterine condition. So this is the advanced instrument which mimics the exact uterine condition. That way, the quality of the eggs which is retrieved from the patient is kept intact. Then the next role of embryologist is to process another set of gamete, that is sperm. The sperm is generally produced in the male partner. Then the semen sample is collected and then it is washed and used for the procedure. Then after the gamete are handled and fused in a process called intracytoplasmic sperm injection. This is a very specialized technique in which what we do is we hold one egg and we inject with one potent sperm which could result in a fusion of egg and sperm and give us a stage called embryo. So once egg and sperm is fused, then the embryo is formed. So basically, the embryologist's role is to handle everything that, like I explained, egg, sperm, embryos, till it is transferred back in the uterus, which
Okay,
could
okay,
result
ma'am.
in a healthy pregnancy.
Okay. So, can you tell us like what is the duration of freezing and like how does the freezing affect the eggs or like sperm quality? and like and like our like elective egg freezing and fertility preservation, if it is the same thing, if you can tell us a bit about that. We have been getting questions from audience also, so yeah.
Sure. So, like ma'am has explained this very elaborate manner, egg, sperm, and embryo. There are three types of freezing which is done. So, egg freezing is the unfertilized egg. So, when I say egg freezing, that is like the egg directly which is retrieved from the patient. We go ahead and do a preservation. When it comes to sperm freezing, it is the sperm which is collected from the partner. We take it and we freeze it for future use or for fertility preservation. When it comes to embryo freezing, stage which is formed after egg and the sperm is fused. So this is called as embryo freezing. So when we talk about all three different type of freezing, the egg being sensitive, so we always prefer embryo freezing. The reason being, embryo has a potential to withstand high and low temperature. When we do a freezing, we expose the embryos or the eggs to very high temperature to very low temperature. This is because to stop their metabolism, so they are intactly stored for years together. So you have asked me one more question. What is the impact of freezing and unfreezing the egg? Nowadays, the technology and expertise and the media have developed so much that we have a survival of about 99%. However, when we are freezing, as such, the quality of the egg or the sperm or the embryo is bad. It might not stand the high and the very low temperature. Again, this is ruled out from the expertise and media to some extent, but it is also internally supported by the quality of gamete and the embryo which we cryopreserve. So there is no duration as such, we can freeze egg and sperm forever. So we are motile, we are mortal. But when we freeze egg and embryo and the sperm, they are in their, like you say, they go to hibernation state where their metabolic activity is zero. So irrespective of tomorrow, whoever has frozen is there or no, but their activity of frozen egg and sperm remains very intact. But according to our guidelines, which is given to us right now, we are allowed to freeze and keep the gametes and the egg for 5 years. However, there would be exception for onco fertility patients because of their medical reasons.
Okay, okay, ma'am. Okay, so another question I wanted to ask is like, is it is fertility preservation a good option for women who are diabetic? Like, can they do it?
I think Chandana would be a
Yeah.
appropriate
Chandana ma'am,
person
can you
to
please
answer.
answer this?
Diabetes and other medical issues like thyroid, blood pressure, they have become quite common nowadays, and we see in a lot of younger age group. So as long as it is detected and well controlled, it wouldn't have long-term effect on the egg reserve. So they will be treated as a normal, cases like how we advise the fertility. But if there is an uncontrolled diabetes and we see their egg reserve is going to decline and they are not yet ready for the pregnancy, yes, probably we can preserve the eggs. So once their sugar levels, everything is optimized, they want to have the pregnancy after 1 to 2 years, they can always come back and have the treatment continued and have a healthy baby at that stage.
Okay, ma'am. Okay, thank you so much. Another question we have from audience is like, what is the best age for fertility prevention for men and women, and like which city has the best facility?
Okay.
So,
So the
do you want
answer to the first query is, as I was mentioning, probably under 30 is an ideal age, because in females, definitely we have seen the egg quantity and quality goes down once they cross 30, and it will be even more, worse once they cross 40 years. So males, though the age doesn't have that drastic effect, like unlike females, but still the quality of the sperm can go down. So always is better the sooner we do. And then which city has the best? Probably nowadays all the metro cities with a decent IVF setup, and whoever are using vitrification technique for the preservation of the gametes, they will have the better prognosis.
Okay. Okay. Thank you, ma'am. Thank you, Chandana, ma'am. Thank you, Dr. Yashwani, ma'am. Now, I have some questions for Dr. Puspha Ragaveni. Hello, ma'am. Welcome on board. And so I have because we are dealing with the emotional aspects and like the psychological support in this process, I would like to ask you a few questions that what do you think, like what are the emotional aspects involved when a person has to go through fertility preservation, and like how popular do you feel it is in India, and do often like the couples or whoever is going for this process, they need help, and how helpful it really is? So can you just tell something about this?
Sure, sure. See, as Dr. Chandana ma'am has already explained, there are two categories here. One, delaying pregnancy due to social causes. It could be because of financial arrangements that they want, or because they want to grow really well in the career. So, or there could be medical reasons like oncology patients with cancer diagnosed, and that could actually affect their fertility treatment. I have seen a lot of people, and even the researchers have said that people who cancer survival patients or people who have postponed due to social causes generally decide to have a child after they have recovered from that. At a certain point of age, they generally wanted to plan for a pregnancy, and most of the people regret that they haven't known the option of fertility preservation. In India, mainly, a lot of people don't know that there is an option of fertility preservation, and that is why we actually wanted to educate people also on this. So if you're talking about the cancer patients, there is already the fear of death in the patients. There will be depressions and anxieties, and the self-esteem really go down with the diagnosis of cancer itself. And on top of it, inability to procure more children, that actually makes them feel empty or the sense of loss in their life. So it is very important that we actually educate them properly. So with this life-threatening treatment, life-threatening problem that they have already diagnosed, there is a lot of time pressure for the patients. Now they have to start their chemotherapy or they have to start their treatment for the cancer as soon as possible. But at the same time, at that short span, if they have to actually decide on going for a fertility treatment, they need to have proper uh, uh, proper knowledge on what could be the factors. They have to go ahead with, should make the decision to go for a fertility preservation. They should meet the right person. I think these days people are getting little educated. They're sending them to the fertility hospitals, and we're actually counseling them to take a proper decision on that. But otherwise, after certain point of time, when they are able to survive the cancer, or when they're able to achieve in their career, and then they realize that they don't have proper oocytes or the sperm quality is low, then patient go through a lot of depression and they start feeling emptiness, and they really regret their decision ki, why did I actually earn so much, or why did I not take that decision on the right time when I'm supposed to actually do that. And there are a lot of patients who would always ask me why there are no proper studies on that, or why people are not telling us. People come to us very late. They probably come around 35 or 38 and say, now we have decided to have a child, and then by then their egg count or the sperm count can come down. So it is very important that people go through the right place, and the counseling plays a major role in that, so that they can avoid the future self-esteem problems of them or getting into depressions.
Okay, and can you tell like how what is the role of psychologists in decision making, for fertility preservation? So, how a psychologist can like help in making the right decision, because there is lot of skepticism around this area also. So, how like a psychologist can help? So, if you can briefly tell us about that.
See, when it comes to fertility preservation, if in case they're going for a social cause, or they don't want to get married now, or they have a problem of cancer kind of treatments, and they're basically they have to face uncertainty about the future relationship. At that point, they're not actually ready about a relationship or a marriage. But then thinking about the child basically becomes a challenge. People go through a lot of emotional turbulence during that point of time, and counseling can actually help them. In the counseling sessions, we actually listen to them, make them talk about all their fears or whatever dilemmas they have, and the counseling can actually help them to come to a proper decision on what could be the future and what could be the consequences of that, and what they can actually choose for it. And the second thing is, if there are any pre-existing psychological factors for it, already if the patient is having any kind of low self-esteem issues, this can add to more stress levels for them. So during the psychological counselings, we can identify and we can make them prepare to empower their emotions. We make them become more stronger so that they can face with whatever decision they are taking during this treatment part. And if in case in the future they have to go for a third party reproduction, suppose they did not take the decision on the right time, and then if in case it got delayed and they have to go for a third party reproduction, they have to go for a donor egg or donor sperm, then it becomes too much problematic and it becomes too much stress level. So even at that point of time, counseling can actually help them so that they don't need to go through a third party reproduction at some point in the future. And in the counselings, we can even discuss about the pregnancies and the miscarriage rate and the fears that they have about it. And in the counseling, we can also discuss about the ethical aspects of freezing and mainly the cryopreservation. There will be a lot of ethical aspects, and patients will have a lot of doubts on that. And counseling is the only place where they can discuss for a longer time. They can talk about every angle. They can talk about every small decision-making issues that they have, and it can be clarified. And if in case there's already any pre-existing stress levels for them, counseling can actually make them have a little relief, and they can go through this treatments or taking a decision in a right way, so that the emotional support is always given parallelly.
Okay. So also we would like to know, like, is there any age specific approach or counseling for people who come for fertility preservation?
No, there is nothing age limit for that. At any age, actually, counseling can help. As Chandana ma'am has already addressed, for going to the fertility preservation, it is always better to go before 30s. Okay, because after that, if in case we don't have much oocytes or the reserve has come down, then again we will have to regret about it. So it is always advisable to come early if in case they are not planning for the pregnancy. Now we see that there are a lot of fertility issues increasing these days. So it is always advisable to do it before 30s.
Okay. Thank you. Okay. So one more thing I would like to know is like if you had any cases where like one of the person, like suppose a couple, one of them have decided like not to go forward with this, like due to fear, or whatever myths are surrounding this process is there. So maybe the husband is not okay with it, or the wife is not okay with it. So how, like, if somebody suppose they are not even getting psychological help, or not visiting a psychologist, so any message for them, like what will you suggest to people who like still have doubts, so how they can go through with this process?
Yeah. The first thing is the education should happen from the healthcare doctor. The doctor counseling plays a very major role here. Like Dr. Chandana ma'am or anyone who actually advises for the right treatment. If they advise, that's the first counseling happens then and there. Okay, so there will be a lot of influence if the healthcare doctors can actually do the counseling to the patients. And even after that, if they are not ready, they can always advise at least one partner to go to the psychologist. It doesn't mean that both the partners should go together. It would be wonderful if both of them can come together. But if not, at least one partner, so that we can identify what are the fears or what are the limitations for them to take the decision. What is happening to the other partner, and probably we can give them some communication strategies on how they can discuss with the partner, and that can solve the purpose. So if not one, at least, if not both, at least one can always approach us.
Yeah, I would like to add here, as Pushpa was mentioning, most of the time, either the husband or wife, they'll be having more of myths. They're not actually facts. They'll be thinking probably, they're going to lose out on the eggs if they do the egg preservation. In future, they may not be able to conceive naturally. Or the other commonly asked query is, will our own gametes be used? Will there be any mixing up of gametes? So all these queries, when we answer them, when we counsel them proper way, majority of the time both will be willing to do the treatment. Obviously, like people still have issues, we'll be sending them to Pushpa.
Okay, ma'am. Thank you so much. And another thing, what like in audience, they want to know like whether this process is cost effective, and if I am from a background who is like financially not very stable, so would I be able to afford it or not?
So, sperm freezing basically is not at all costly. It is, it depends on how many samples of sperm they want to freeze and for how long, and it will be just in thousands. Egg freezing probably is, because this involves the hormonal injections and also a process in which we have to actually collect the eggs from the body. So, probably nowadays there are a lot of like insurance and as I was mentioning, companies as such like Google, Facebook, they are funding their employees for this, egg preservation for the future use. And again, the pricing depends on how many eggs we are freezing and for how long. So there are a lot of other insurances people are coming up with. Not only that, there will be EMI options as well. What I would suggest is first discuss your case with your fertility specialist and see what is the best plan for you, and obviously finances can be taken care there.
Okay, thank you, ma'am.
I would like to add, there are few companies who are giving EMI options also.
Oh, okay.
And that facility is there, they can always take that and keep paying.
Yeah, I think this will be good. And one more question we have is we know the positive sides, but what is the cons of what are the problems, what are the risks? There can be some risks while fusing eggs or sperm during the process. Are there any risk involved?
Yashwani is there, or you want me to take over?
Anybody, whoever is comfortable answering.
Sperm freezing absolutely risk-free. There is no risk associated to the patient because it's just like doing a normal test, like how they do a semen test. The same sample will be frozen. So, if the sample is really poor, if the count or motility is very less, probably the chance of survival may not be that good, which will be assessed even before we put the sample for freezing. Egg freezing, yes, the only process is there is an involvement of hormonal injections, which if we plan according to the requirement, according to the age of the patient and according to the weight of the patient. So even with this hormonal injections, the risks are almost minimal. And when we do the egg pickup as well, we plan it in such a way that she won't have any problems, do a careful egg pickup with very minimal sedation required, we haven't seen any major problems here. And egg freezing, as Yashwani was explaining, though we have good survival, embryos are more stronger than eggs. So wherever there is a feasibility when they are married, we prefer to go for embryo freezing. But for the unmarried women, yes, we can do the egg freezing, and with this vitrification, even the survival rate of the eggs is also better compared to the previous freezing methods like slow freezing.
Okay. Okay. Thank you, ma'am. Ma'am, anything else you would like to add? Like this is like open question to everyone. Like anything else like you think like it should be beneficial to people who are looking forward to this process, you can share with us.
Sure, sure. So I will definitely like to add on, onco fertility. We have seen lot of people who have undergone cancer therapies and having issues with the sperm and egg later on, regretting that we were not aware of this option of fertility preservation. So nowadays, lot of oncologists, as a part and parcel of their cancer treatment, they are doing this pre-cancer treatment counseling. So we all work like a multidisciplinary team, and I think this should be more generalized, and more patients need to know about this option. Not only that, for the social reasons as well, as we were discussing about it. Females' age is very important. So people who want to really postpone their pregnancy, marriage, they should definitely consider about the fertility preservation in order to have a healthy pregnancy in future.
Thank you, ma'am. Yashaswini, ma'am, and Pushpa, you want to add anything like any you want to share anything with us
If
regarding
in,
this process?
if in case anyone has any doubts, don't hesitate to take
Yeah.
help. I would always suggest contact us. We are there. All the medical facilities, everybody would be willing to answer all your queries. So don't stay back with your own doubts and inhibitions on it. Make sure that you take the help required and don't regret in future.
Okay. Thank you so much, ma'am. Ma'am, Yashaswini, ma'am, you want to share anything like?
I would like to add just one point. When I get a question myself, what I do is just Google things. But I would always suggest patients not to do that. Google has source of information from everywhere. We don't know
Yeah.
what is true and what is not true. So if I
And
read
WhatsApp
something,
forwards also like it can be so misleading.
Yes.
yes. So you have so many experts around you when you want to go for fertility preservation and egg preservation, because it's a very important decision in your life. It is the way you reproduce and have your own children. So please do not Google and have some wrong notion about a commonly said thing is, will the IVF babies be normal? They are absolutely as normal conception. So people, I would request everybody not to Google and consult nearby experts and get the best treatment for yourself.
Thank you so much, ma'am, for
Thank you.
joining us. Thank you, Dr. Chandana, ma'am, Dr. Yashaswini, and Dr. Pushpa. Thank you so much. And like whoever is like watching this live with us, like they know now like how to go with this. Like there are doctors, psychologists who can help you and get through this process. So thank you so much, ma'am, and good day. Thank you so
Thank
much
Thank
you.
you,
again.
Deepa.
Thank you for your time. Yeah. Thank you.